Welcome, everyone, to another edition of 45 Forward, where our mission is to help you, our listeners, from Los Angeles to Long Island, make your second half of life even better than the first. Pediatrician Mark Vonnegut has spent nearly 40 years treating children for coughs, fevers, ear infections, and sometimes more serious medical conditions. Over that time, he has seen the U.S. healthcare system change in ways he couldn't have imagined as a medical student. Some good, others not so much. But what hasn't changed over the span of his career is the commitment to his young patients, whose stories fill the pages of his new book, The Heart of Caring. In today's episode, Dr. Vonnegut recounts some of the cases that have stuck with him over the years and what he has learned from them, as well as the challenges he has encountered in the practice of medicine. He doesn't pull any punches. He talks about the consequences of the privatization of healthcare, the skyrocketing costs of insurance and pharmaceuticals, and the barriers to adequate mental health services. But along with his diagnosis of the healthcare establishment, he offers prescriptions for making the system better and more centered on what's good for patients. Over the course of today's conversation, Dr. Vonnegut, a three-time author, will take us along the journey of a career that ultimately is a love letter to his patients and his profession, with many heartbreaks, but also many great hopes. So now let's meet our guest, Dr. Mark Vonnegut. Mark, welcome to the show.
Thank you very much. Glad to be here.
Yeah, it's a pleasure to have you. Um, so I know that, like you were a young man in the turbulent '60s and so forth, and this was a time of great exploration, upheaval, changes, and you didn't go right into medicine. So to tell us a little bit about how you ended up choosing the career in medicine and then pediatrics.
I think we honestly thought that the economy as we knew it and the world as we knew it wasn't really going to survive.
Mm.
Um, and so we took to the woods, tried to set up a self-sufficient commune. It was very interesting. I don't regret any of it. But then when all the things we thought were going to happen didn't, what we were is a bunch of guys and gals, people in their mid-20s without jobs.
Mm-hmm.
And so I had to think of, well, what should I have done? What would I have done if it hadn't been for all that turmoil? And I thought, geez, I should have been a doctor.
Mm.
I like math and science. Uh, so it seemed, and that I got incredibly lucky that I went back to UMass. I went to UMass Boston, did chemistry, organic chemistry, all that. And I enjoyed being a student, and I got lucky and got into medical school.
Hmm. Wow, wow. And then, of course, in medical school, you have to make the second decision, which is what do you want to do with that? I mean, a lot of people go into specialties,
Mhm.
and that's what I found interesting, especially about your book in pediatrics, because you hear a lot about highly specialized medicine. That's what our country is great at. You know, um, doing extraordinary surgery and extraordinary specialization in various fields. But not the pediatrics is a specialty too, but it's something that people don't normally write about and talk about. So how did you end up in pediatrics? What made you would gravitate toward this field?
I had actually thought I was going to be a family doctor. I like the idea of not knowing what's going to come in the door.
Mm,
Um, and and the variety of the unpredictableness. And then I figured out that in New England anyway, most people take their kids to pediatricians, and the kids was what I liked best about medical care. One of the nice things about medical school is you get to try out things, like you
mhm.
will be a plastic surgeon for a month, or you'll deliver babies for a month, and you really get to hang out, be on call overnight, whatever. And you say, ah, you know, I could do this. So, and I think in life in general, it'd be nice if you could try out, being in the trades and whatever, and then figure out what you want to do. But for me, I definitely love doing pediatrics more than anything else, and I like pediatricians.
Right. Yeah. Yeah, and to me, it's an incredibly important first contact for a lot of kids. I mean, I remember very, very well, Dr. Pastor. He was our first pediatrician, and I remember going, I know today where his office was. I remember going in there. I remember his manner. I think for children, it's incredibly important first contact with medicine in the world. So I think you play a critical role in that capacity.
And it is, and it's something that I'm worried is going to be, lost, in that now you hear about urgent care centers and CVS or whatever are going to try to take over primary care. And I just think a lot is lost if you don't have a continuous or a relationship you can really count on, like having been in the same community for 40 years. People know me, people trust me. I don't have to do a lot of x-rays or blood tests to prove I'm a doctor.
Right.
And it's great for me, and it's great for the patients. And I fear that the next generation of patients and doctors isn't going to be able to have that kind of continuity and fun. It's
Right.
more, it's fun to practice the way I
Yeah.
do.
Yeah. Now, what's fun about it? What do you like about it?
Some of the stories I tell,
Hmm.
and there's some from every day. Like today, I had this very wonderful, bright, hyperactive 10-year-old girl looking in, and she said, "I like your sneakers." And I said, "That's great." She said, "They're red, and your blue shirt doesn't go really well with the sneakers." So I said, "Well, thank you. I need all the help I can get fashion-wise." But I don't think internists have a conversation like that. Um, or, telling somebody, "Well, you have to pee in a cup. I have to do a test." And the kid looks and says, "What's wrong with your bathroom?" And, you know, kids are just, they are so, in the moment. I, I don't think it's possible to be taking care of people who you taken care of before, you're going to see them again, and to be depressed. Or if you're depressed, there's something wrong. But
Hmm.
the practice of pediatrics, I think, does keep you young and lively.
Right. 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 And I think there are different stages of medicine too that one experience. So first, it's pediatrics, and you're dealing with children and their parents, right? I mean, you're trying to, which is, and it's important. On the flip side, as people get older, and their adult children bring in their parents, it's always tricky, a little bit tricky to realize, well, who's the patient? No, that's
Right.
keeping a focus on the patient. But so how do you develop trust with both the parents and the kids?
You respect boundaries.
Hmm.
Um, and I think you are sincere. I'm trying to think of the things that I think interfere with that. I
Hmm.
think if somebody waits for 20 minutes to be put in a room, to wait another 10 minutes, and somebody comes in with a clipboard or a laptop and is clicking away at it and not looking you in the eye, and the visit only lasts 10, I mean, that's what you don't do to
Right.
establish trust.
Right.
Um, there are small things I do. I don't wear a wristwatch, because I think there's a tendency, and I've been with doctors who every once in a while sneak a look, or they'll say, "Oh, you realize this is only supposed to be a brief office visit." So I think it's important for people to have the sense that they have all the time they want or need. Um, and I think it's, you get the right diagnosis more often if you don't interrupt the patient. Somebody did a study where they said in the average emergency room encounter, the doctor interrupts the patients within 10 seconds of the patient starting to tell why he
Wow.
is there. So I think there are tech, I understand, and I do let my younger clinicians take in their iPads and but it's important for me not to have a computer in the room. It's important for me to make observations about, like, "You look really good," or, you look sort of anxious. What are you worried about?" But so you're looking at the person and having, a conversation about, you know, too bad about the Patriots or whatever,
Yeah. Yeah. Yeah.
and then I think naturally the diagnosis comes out of that rather than any sort of scripted encounter, which is
Yeah.
what we're supposed to be doing now.
Yeah. Yeah. I'm sure we'll get into a little bit more about this later, about just the practice of medicine. But I think, you're right. And it's tricky because, I've had certain experiences of, waiting for a while, and then you say, come on in, Mr. OL, fine. And I come in, then I'm in another room and I'm sitting in there. And then precisely as you describe it, one of their assistants comes in with a clipboard and starts going through stuff.
Exactly.
And I'm obviously not a small child, but still there's a little bit of like, okay, like when do I see a doctor? And I kind of get it. There's certain efficiencies in medicine. You're trying to, you know, basically make the best use of the doctor's time.
Mhm.
But I'd rather talk to the doctor. I would. And I do understand too that when you wait for a while, it does, cause a problem, some certain anxiety among the, patient. Yet I kind of get it sometimes, and I got this from talking to my older brother, in his practice, and that, he said, "Listen, I know it could be frustrating, but you have to understand. I don't know. Sometimes I don't know how long, consultations are going to last. I
Right.
can't predict that. Sometimes stuff happens. I've got to attend to. I'm learning stuff, and it's just like I can't say, well, you've got 12 minutes. So, it's difficult for doctors to kind of, have a predict the schedule so tightly that you can do it, the way, an attorney or an accountant might. Yeah.
I still think that the important thing is the patient, and the important thing is the patient's time. And um, and I think that used to be that way. I think 90% of what an office doctor did or a hospital did was to directly ascertain and address the needs and the concerns of the patient.
Mhm.
Um, and I think part of being trusted as a doctor is you have to make the patient has to matter and their time has to matter. And if you're late, I think you apologize. and
Right.
and so I think if yes, sometimes their delays are unavoidable. I will sometimes tell a patient, this is too complicated a problem, come back next
Right.
Saturday or
Right.
whatever. But I do think letting the patient know that their time is precious is part of being a good doctor.
Right. Right. Um, so how has it changed over the years, from when you started the
Mhm.
practice, specifically of pediatrics, what have been some of the changes you've seen?
It used to be that patients um, and families had their choices, and there were like in a small community, there'd be 3 or 4 family doctors or whatever, and people would choose who they went to, and doctors were well behaved and nice because if they weren't, the patients wouldn't come back. Um, and now patients have less and less choice. People are told, well, I can't see you anymore because you're not on my panel. Um, and
Right.
and stuff like that. And it used to be much more intimate because we were charging 10, 15, and $20 a visit. We were very stingy, kept our overhead low. I paid back my student debts in less than a year.
Wow.
Um, there was, so, I mean, things were, it did not feel corporate. The
Right.
problem now, I think, is the number of for-profit corporate entities that are involved in, so the patient has to go through all this rigmarole to get to see a doctor in the first place.
Right.
I
Right.
used to just I went out to the waiting room. I brought you back. I weighed you and measured you and did your blood pressure. And along the way, I got a sense, oh, he's limping a little, doesn't whatever. But you learn a lot. And by not having the receptionist and the insurance verifier and the medical assistant and all the vital. So if I still sometimes, especially with mental health or behavioral health stuff, I'll go to the waiting room, take the patient back myself and say, let's deal with the co-payments and everything afterwards. So
Okay.
I sort of flip the visit upside down.
Yeah. Yeah. So just so I know, what ages does pediatrics cover? At what point do you hand off to another, internist?
You try. It's a real problem finding internists who are interested in taking care of young people. I don't think they
Oh,
see the point, or they're not familiar enough, and they're sort of frightened by kids with serious problems, kids with autism or Down syndrome or whatever. We're used to dealing with those serious issues, and I think there's a crisis in all of primary care where the internists feel under a lot of pressure, and for them to take on new patients and fill out all those forms, so it's hard to find good care for young people moving on. And there's only so much we can do about that.
right, right. Yeah, I mean, yeah, we'll talk, I'm sure, more in our last segment about, the system in general as we get into your book. But I think it is certainly an issue, and I think that, you mentioned that you paid back your student loan in a year. Of course, that would be, by today's standards, a miracle, right? For many students, and I think that's a problem. So people come out with this huge debt, and they see themselves forced into situations where they've got to make compromises and join big practices, and that's I remember even on, again, the flip side, when I was my family was looking for a kind of boutique care for my mother, an elderly mother. So instead of, you know a large practice, we had a doctor who was, I guess, I had they just, had limited number of patients, but even they had hundreds of patients, and I was
Mhm.
like, wow, how do you keep track of this? Well, look, we're going to take a quick break, doctor. When we come back, folks, we'll be talking much more with author and pediatrician Mark Vonnegut. So don't go anywhere. Welcome back, folks. We're talking today with pediatrician and author Mark Vonnegut. Before we continue, I just want to let you know that Mark is the author of the current book, The Heart of Caring. And during this segment, we're going to continue talking with him about the practice of medicine in general and pediatrics in particular. But we'll talk more specifically about the book. So, Mark, why don't you decide to write a book, first of all, on this topic?
It I think my wife got tired of me talking about
Huh. Okay.
about it, and so she thought it was a good idea, and eventually I said, yeah, that is a good idea, because there are all these wonderful stories, and also there is sort of the arc story of how medical care has changed, and how the two have been intertwined, and how I've really, loved being a pediatrician. And there's a certain sadness for me in how things have changed, and how, I think there are many people in medical school who would love to be primary care pediatricians and stuff, but the finances and the student debt and everything else that wasn't really a problem for me is a problem for doctors today.
Right.
Doctors
Right.
coming out of medical
Right.
school.
And just for the information of our listeners, you do come from a important pedigree. Your dad, of course, is Kurt Vonnegut, one of my favorite authors. And from what I understand, you were named after Mark Twain. Is that right?
Yes, and I'm glad he dropped the Twain out of the
Right, 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 right. But I'm glad you decided to write on this topic. I think it's really important, and so I just want to talk a bit more about some of the stories in the book. You told one story of a child, but what are some of the other cases, if you don't mind, just thinking about that struck with you in terms of things that you learned from them, and things that you didn't expect in the process.
The nice thing about pediatrics is you never know what to expect. If you're a gastroenterologist, you know you're going to have so much, peptic ulcer disease, this, that, and but I never know what's going to walk through the door.
Right.
Um, you, I had, there was, a family, man and woman came to see me and said, we've been told we should have an abortion because we have a child who has osteogenesis imperfecta, which is this
Wow.
dreadful brittle one. And they said, and we're not going to do that. So what should we do? And what do you think? And I said, I think you're incredibly brave people. I'll help you to the best of my ability. But being included in a story like that, or there was one where one of my patients is getting more and more anemic, and it turned out he had a fatal bone disease unless he had a good match for bone marrow.
Mm.
So the family had a fifth child, and it wasn't. So to me, this is just a great joy. Whereas the hematologist was saying, "Do you think it's ethical to have a baby just to be a bone marrow donor?" And I said, "That's not the point." And I said, but I know that kid grew up to be the strongest, handsomest, smartest brother of them all. But
Wow.
so to be part of a story like that is a great, great joy.
Right.
Um, and there are tons of them. Sometimes I just want to sit back and let my patients talk because they're so wonderful.
Right. 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 Do you get a sense of changes over the generations, or basically it's just that the same sort of, you don't know what to expect, but that kids today are kids 40 years ago?
I think it's much harder to be a child. I think there's so much more pressure on kids.
Uh-huh.
I grew up really in a pretty innocent world, in retrospect, of the 50s, where uh, I thought life was really pretty easy. I wasn't, uh, I felt like I had an infinite number of choices. If I wanted to be a lawyer, I could have been a lawyer. If I wanted to do this, but I felt it was that way for everybody in my generation. I didn't have a sense of the inequalities and racism and all the things that kids now watch on TV from very, very young. So I think kids feel they're under academic pressure, social pressure, and you have preteen kids who have full-blown depression and anxiety. I
Right.
don't think that happened very often when I was growing up.
Yeah. Yeah, I would tend to agree with you. I don't, obviously I'm not a researcher, but it does seem that, at least the preliminary research we have shows that there are certainly many more feelings of stress and anxiety and, yeah, pressure. And I mean, some people, a lot of people blame social media, and, I guess one could consider that a component of it. But it does feel that well, the world is heavier to young
Yeah.
people these days, and that between I mean, never mind all the daily stresses. I mean, you have climate change in the background. They're worried about is there what's the world going to be in 30 years? They keep getting stories about, well, we have 30 years to deal with climate change. Otherwise, we've run out of time. And I think that you and I we didn't have devices, cell phones when growing up. Um, and as far as I can figure, the most useful thing about them for me is that I can contact people when I'm late for appointments, or know where my kids are, and so that's helpful.
Mhm.
And like I can Google things when I can't think of somebody's name. So, but I think otherwise you know the the attachment and the dependence on it is I
Mhm.
think you know stressful, right? I mean, this.
And I think as parents are more worried about what would happen, what their kids' choices and opportunities would be. I honestly don't think my parents gave it a second thought. Say, oh, he'll do something, you
Right.
know. And um, and now I think there is much more for kids to worry about. I have who I call my refresher course, is he's now 19, and I had him in my mid 50s, and I drove him to school every day, which was wonderful because you're just sitting in parallel and you have these wonderful conversations. But something disturbing had happened politically, and I just said, I never thought I would live to see da, 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 da. This is so discouraging.
Right.
And what he just said, just looking straight ahead, he said, Dad, welcome to my world. That
Mm,
sense of, things aren't going to be easy. And that's what he and his friends were growing up with.
yeah. 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 I mean, when I went to college, it was like, I was a liberal arts major, and it was like, well, this is just kind of free time to think,
Mhm.
and it wasn't
Yeah.
wasted.
Right.
Certainly I had time to explore things, but um, I do get the sense that this generation of kids, and right through college, feel that they don't have that time. They've got to make
Right.
decisions faster.
Right.
Right.
I
And
love my son has gone from, he was going to be a lawyer. So what did I do wrong? Am I going to have two lawyers in my family? And now he wants to be a philosophy professor. I couldn't be happier. Good, good. I'm sure you'll be underpaid and everything. But, I think finding kids work through the anxiety about what is their life going to be like, and really to find something they truly love.
right, right.
Um,
Yeah. And I think also getting through the expectation of what's happening now is going to be happening 5 years from now.
right.
Um, and I think that's, I look at many people in their professions, and, certainly it's not like, well, you didn't go to college to do that. There are many professions
Mhm.
that are somewhat intentional like yours, but also accidental. You had a little time to think about it, and then you said, well, yeah, medicine would be good. Yeah. So I think that it's difficult for kids these days to feel that they have the time to make decisions, and also that it's like, you know don't worry about it. Of course, when you say that, the minute you say that, they're worried, but
Right.
it is true that you do get some perspective on that things will change, and that the natural state of things is being able to adapt to changes. So um, um, speaking of changes, so let's shift a little bit now from pediatrics to the healthcare system more broadly, and some of the things that you've seen there. And there, yes, it's changed dramatically. You started to talk a little bit about it, but what would you say were some of the main things you've seen that are problematic in terms of the way it's evolved?
I think disrespect for patients and their time and their values, and inaccessible medical care. Most of our community and rural hospitals, we've lost 40% of them. We've lost like 80% of the community doctors that used to be centered around community hospitals. Um, so we can do incredible things I could have only dreamt about in medical school, solid organ transplants and stuff. But the access of the average person to routine medical care is much less than it used to be.
Hmm.
And I do think when I was an intern or a resident, people would walk into Mass General. All you had to do was have a child and a complaint. There were no co-payments. There was no, we'd check your insurance later. And I thought it was outrageous that it cost $100, for an emergency room visit back then. And I think the amount of money involved has changed things greatly. I mean, I
Hmm.
think it used to be a gentlemanly, we didn't have to worry about, making a ton of money. And as I say, people coming out today with $250,000 to $500,000 of debt, and to have that's what's on your mind rather than what am I going to do to be of service to patients.
Right,
So
right, yeah.
it's a
Now there've
big
been
change.
a couple things, some of them I think have been um, uh, elevated by the pandemic, but one of the things that's come is telemedicine, right? What are your thoughts about telemedicine?
I get grumpy about that too,
Okay.
because because I used to, and I still do. I call my patients back, or I call them to see how they're doing all the time. I I feel, why should I fill out a piece of paper that says, was there a video component? Was
Right.
the patient in New Hampshire or Maine? Because we'll pay X number of dollars if they were in New Hampshire, but and it goes on and on and on. So fine, the fact that they'll pay me something for it, I'm supposed to be grateful for,
Right.
but I don't like being paid for things I did routinely, which was talk to people on the phone all the
Right.
time.
Yeah. Yeah. I guess for me that my feeling was that it was useful in one sense, which is that once I knew the doctor,
Mhm.
once he or she and I had some consultations, so then it was, well, especially during the pandemic. Okay, so, but also for people, I suppose, in rural areas, again, if not for more serious examinations, but if you know what the issue is, and then we just want to talk to the patient, and you really can look at the patient, and like, for example, I had a swollen finger. I went to a rheumatologist last year, and after we had an examination with her test, and then she said, okay, show me the finger. So we could, it was a way that we could continue contact without having me drive there. So I think
Mhm.
there's usefulness to it, but I agree with you that then you layer on this bureaucracy of like, well, what kind of call was it? Was it this? Was it that? Would the
Right.
reimbursement for this? That's gets crazy.
It is crazy. And it used to be, we answered the phone, we return calls, and that was just part of the deal. And I agree, for me to, a lot of the care we are mandated to give, like, okay, this kid has asthma, he has to come in for an asthma check. I call them, they're not taking any asthma. They're not having any symptoms, but I'm supposed to bring them in. But now I don't have to. I can do it on the phone, so I can do useless care. The patient and I are no longer in charge. They say, okay, you need a refill of medicine. You have to go see the doctor to get this refill. That's just all, from my point of view, wasted time and money, you
Right.
know.
Right.
It's
Yeah.
just, oh, any side effects? No. Grades are okay. How's your mom? Okay.
Yeah. 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 You don't need to fill out forms. I mean, and certainly, the continuity of information is important. So, that's one thing where I'm still, perplexed that that we do have the technology to make that more streamlined, right? I mean, to go to doctor to doctor and to fill out the same information all the time, if that sort of stuff can be transferred from doctor to doctor, so that we really can talk to the doctor about what's
Mhm,
what's the problem, what are we trying to figure out, instead of
mhm.
repeating the same things over and over again. But yeah, so that's where I think we've I'm not sure what the reason is. We have I guess it may be HIPAA. I'm not sure, the confidentiality of information as it passes from hand to hand, but
Yeah.
I I I have my suspicions it's not. But
Yeah, I don't think it's sometimes I just think we had this old fashioned thing, which really was great for patient safety and referrals. It's called a telephone. I would pick up the telephone, call the emergency room, tell them what was coming and to call me back or whatever. And now it's all clickety clackety and the emails go out into the ether.
right.
And there used to be very immediate contact
Right.
between doctors and referrals and stuff.
Yeah.
Doesn't
Yeah.
happen anymore.
Yeah. All right, we're going to take another quick break, Mark. But don't go away, folks. We'll be talking much more in our last segment with Dr. Mark Vonnegut, pediatrician and author. Welcome back, folks, for our last segment with Dr. Mark Vonnegut, pediatrician and author. Uh, now, there's a lot more we can talk about in terms of the healthcare system, in terms of what the issues are. But one of the big issues that I think I wanted to make sure we had a little bit of time to talk about is just the, psychiatric care and the mental health issues, which you've had some firsthand experience dealing with, and I think it's a little bit that I do quite a bit of work, volunteer work for the Alzheimer's Association. And I know that one of the issues there is just the stigmatization of the disease and just sort of the great silence about it. And I think that's similar with mental health issues. And certainly it's become a little bit more elevated in terms of public issues. Again, partly because of the pandemic, people have been talking about it, and people worried about the mental health of children and isolation of seniors and so forth. But it was there before the pandemic, as you well know. So what are your thoughts, doctor, about how we should I don't want to say fix, but basically improve mental health care?
I think there are things that need to be fixed.
Okay.
There are resources and facilities and personnel which we don't have, which we should have. Um, they we didn't used to have homelessness. In the late 60s, we closed down all the state hospitals, which were admittedly, and nobody thought the care there was great, but to just take these chronically ill people and let them go and say there'll be this thing called community mental health, and community mental health was never adequately funded. So you created a whole lot of untreated mental illness and homelessness. And I think it's bad for everybody's health. But I mean, what we need now is we need financial support for therapists, for psychiatric care, for psychiatric beds. I mean, I had a patient who he was a 10-year-old huge autistic kid with a single mother, and she couldn't manage him because he'd go into rages. And so if she goes to an emergency room, the emergency room is clogged up anyway. If he's lucky, they see a psychiatrist once. They spend days looking for a psychiatric bed. They over-medicate him and send him back to me to manage him. This is just unacceptable. There should be, again, the patient's time matters. You shouldn't have to spend hours, let alone days, in an emergency room to get indifferent care. So I think the public has gotten much better, much more aware, much more supportive, but I do think we need, more nurses, more psychiatric social workers. We need resources that just aren't there.
Right. Yeah, and I think that every time there's an opportunity to increase the resources, doesn't happen. I mean, I think those are the cuts that get made, I think, in budgets. But I think again, incrementally, it's getting better in terms of
It is.
recognizing it. I think that someone like you really come from that experience. I mean, you have a couple of books that you dealt with some of your issues, the Eden Express, and then you have another book, just like someone without mental illness, only more so. So I think it takes people in the profession like you to recognize this and basically advocate for increased resources.
I think a small thing I can do, and I do, is to, I'm completely open about it, when I'm talking to people or even my patients, they don't really care. And people have a lot of natural empathy and sympathy, which my profession as a whole doesn't necessarily have.
Right.
But to just say, yeah, okay, I have mental illness. So, what else can we talk about?
Yeah. 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 And I think, from my perspective too, that in talking with people who have mental health problems, just to listen to them and realize that, okay, I'm not going to pretend that, your life and mine are the same, or even similar, but there are things that, that I can recognize, like, wait a minute, you know, there is a spectrum,
Of
and you're not
course.
so different from me.
Yeah.
And there are issues that are connected between your physiological state and your mental state, and that
Yeah.
I think there are things we can do. We can improve our nutrition, we can improve our exercise, our ways that we can deal with this. And I think going back to what you said earlier on, it does come down sometimes to money. It's like when
Yeah.
people figure out a way to make more money at it, then they'll do it. Uh,
I also think there's a sense that our health is connected, our mental and physical health. You know, my being healthy helps your health. Your
right,
being healthy helps my health.
right,
You get a healthier workforce, you get a healthier neighborhood, you get healthier. If we're in good health, we can take care of our aging parents or whatever. So it's not just individual. And I think especially with mental health, you realize that a mentally ill person not getting good treatment can drag down a whole family or a whole neighborhood.
right,
But on the other hand, if their recovery itself can also be, it builds on itself. You can get a
right.
good cycle or what, it's not a
Yeah,
vicious.
yeah, yeah. I think it's sort of what I think of as one of the unexpected benefits of the green movement, if you will, the
Mhm,
environmental movement, which is just sort of this theme of um, relationships, right?
mhm,
That the environment, there are relationships that affect us, and affect everything in it. So as
mhm,
opposed to an ecological approach, as opposed to a technological approach of just specific problems to individuals, and you're just trying to target that. But so I think that that's been kind of an interesting benefit of thinking that
mhm.
there is an impact, that's greater than just the individual patient. Um,
Connection and relationships are everything. And that goes, from, you know, cancer to, psychotic breaks or whatever. Humans who don't connect or can't make relationships don't get well. And
right,
people who do get well can, again, have positive relationships. We're
right,
social animals.
right, right, right. Um, so in the time we have left, I just wanted to cycle back to some of the things that, if you were talking to medical students today, what would you advise them? What would you say to them?
I say, I've done my best. Now it's your turn. And I do. I have them come to my office and stuff like that. And I do say, and again, say, this clearly has to be fixed. You went into medical school to be of service. You didn't come here to make money. So you have to figure out how can you be of service to patients. I tell them to imitate the nurses. Nurses are going on strike, not for more money. They're going on strike so that they can take better care and have fewer patients. So instead of running around trying to take care of 10 people, they want to take care of 5. And that's clearly about the quality of medical care. And doctors should be not try to be on the side of the insurers and, oh, please, mother, may I give me a little bit more money. They should be on the side of with the nurses and the patients saying, we have to have higher quality medical care and we know how to get it.
Right, right. Now, are doctors in a position to, to basically make that um, request or demand from institutions like hospitals?
As a group, yes.
Okay.
The problem is we keep thinking of ourselves as single knights on white
Right.
horses. And I do think it's not in a doctor's nature to think of themselves as a worker who has certain rights or could organize or whatever.
Right.
But I think some form of the profession saying, this is hurting patients. We took an oath that we wouldn't do that. And so it has to stop, whether it's prior authorizations or co-payments or just shutting down all these hospitals. At a certain point, I think it is up to doctors to say, this hurts patients. And
Right. Right.
we
No.
took an oath.
Yeah. No. One thing that I read about that in preparing for our show that I was not aware of, thinking about it, was um, I guess it's I'm just the article was talking about the shortage of doctors, especially as you've noted in rural areas, but that one piece of the problem was the the Centers for Medicare and Medicaid Services basically which provides payments to hospitals, basically, um, keeping a lid on the funding available to do that. And that so it limited the capacity of hospitals to hire
Right,
residents.
right. And I think the payer, you know, who pays should be of secondary concern. The concern should be, I have somebody with chest pain here, I should take care of them. But the whole idea that insurers got into is we should have less but better medical care. People don't talk about having less but better science, or less,
Mm,
that there is a sense, if you want something to be better, you actually have to devote resources to it.
right,
And I think medical care in general, people say there's waste, so if we take it away, there'll be less waste. It's just, it doesn't work that way. If you want good medical care, you have to invest in it.
right, right, right. Um, so in the last couple minutes, so what would you say to a medical student going in today? What would you say? What advice would you give them besides I've done my bit?
I, but you didn't come this far to have a lousy,
Right.
don't let the suboptimal situation you're coming into rule your life.
Hmm.
Keep your sense of humor. Don't let this burn you out. You're here to do good. You can do some good. And like I said, I look back on, I had a rock and roll band all the way through hospital. I still play rock and roll.
Wow.
And I think I worry about all the financial pressures that doctors are going to get gloomy, and doctors who are gloomy don't take good care of people.
Right. Right.
So I try to keep the mood up. The mood is everything.
I think that's great advice. And I think, I would just say, like, explore different opportunities,
Yeah.
that's not,
Yeah.
that before you get, into one area, there are lots of opportunities. You can go in different areas and explore different parts of the country and explore different experiences in medical care that I think can inform you, over the course of your life.
One thing I almost always tell them is go to Honduras or Haiti or go on a medical mission to, and see how the rest of the world looks and how different patients are when they're not struggling with insurance and everything else. They
Right.
have to walk to get to you, but there's something very eye-opening and refreshing about taking care of people in desperately poor places like Haiti.
Right. Wow. Okay, well, Doctor, well, I really appreciate your time. I'm sure there's much more to talk about, but we'll have to leave it there for today. I wanted to thank you for a terrific, informative conversation. Now, Mark, if people have questions or comments, they want to contact you or they want to get your book, I guess they can get your book on Amazon, right? I mean,
Or yes, or any of the less evil vendors too.
right. Okay. Okay. So anyway, once again, folks, tell your friends if they missed my conversation with Mark Vonnegut, Dr. Mark Vonnegut today, you can listen to it as a podcast on voiceamerica.com. Just search for my show 45 Forward. You can also listen to it on Apple and Google Podcasts, Spotify, iHeartRadio, or go to my website, roelresources.com. Just click on the 45 Forward tab. Be sure to join me next Monday, 12 noon Pacific, 3 p.m. Eastern Time, when I'll be talking to Bill Soltz, the Director of Stress Solutions New York. We'll talk about his distinctive approaches to dealing with stress, anxiety, and trauma at a time when we're dealing with plenty of all those things. So until then, folks, keep moving forward, 45 Forward.